For my project, I'm going to be talking about the effects of exercise on cortisol release. So, cortisol, what is it? Cortisol is a steroid hormone, a glucocorticoid, which is produced in the adrenal cortex and is stimulated by stress. So what happens is our body goes under stress, we get a signal from our brain, and our body goes into our sympathetic nervous system. This is important because our bodies were made that if you need to flee from a bear, you don't want to be thinking about what you were eating for breakfast, but you want all of your blood and your oxygen to go into your muscles. So cortisol helps that flow while the sympathetic nervous system is turned on. Cortisol helps that flow of oxygen and blood go to your muscles. Now, cortisol isn't just released when we are stressed, but we actually have a diurnal pattern, meaning that cortisol is most awakened or most active during the day. So a healthy cortisol pattern is going to look like this. So right here, up at the top, is going to be your cortisol awakening response, or CAR. So about 30 minutes after you wake up, you're going to have this spike in cortisol right here, and then it's going to taper out throughout the day. Now, these little peaks that I've drawn in here are small little stressors that you've had throughout the day. So possibly forgetting your keys at work, or thinking about when your next test is, or even exercise. That's where you're going to have these little peaks throughout the day. But typically, your highest stressor should be in the morning when you wake up, right here, and then having this nice taper throughout the day. However, when we think of cortisol, we usually think of something negative. Why? Because when we talk about cortisol, we usually talk about chronic cortisol release. The problem with chronic cortisol release is we weren't built to constantly have a flow of cortisol going through our HPA axis to our body. So what's happening is cortisol inhibits your immune system. This is important in fight or flight because, again, if you're needing to flee from a bear or from a tiger, you don't need to be fighting a cold. However, our body can't differentiate between stresses. If we're stressed about a mortgage, or we're stressed about our kids, or stressed about schoolwork, it's going to react the same physiologically as if we were running from a bear. So what's happening is you're still getting the same response. So during finals, a lot of times what you'll see is students who are catching colds, getting the flu, getting fevers, and that's because their immune system is usually lower due to cortisol release. Another thing cortisol does is it impairs the hippocampus. Our hippocampus is our working memory. So what cortisol does is it kind of monitors the amount of neurons that are added or subtracted from the hippocampus. So when cortisol is constantly being released, you're constantly having neurons taking away from the hippocampus. And what's happening is then your hippocampus is it's like being sanded down by cortisol. So imagine literally taking sandpaper to your hippocampus and it's getting shredded down because cortisol is taking those neurons out. Now, this can be a problem because we need our working memory. Think about all the times you've been stressed and you can't seem to figure out where your keys are, or where you put this, where you put that, and then you add more stress, and it almost turns into a cycle. The next few things that cortisol does, cortisol is a gluconeogenic hormone. That means it helps out in gluconeogenesis. This is important because we need the breakdown of tissue to turn into sugar. That's a normal bodily function, but the problem with constant cortisol release is the gluconeogenesis then turns into breaking down muscle, breaking down bone, and breaking down connective tissue. This is going to be a problem in anybody, but as I'll talk about later, it's definitely a problem in the elderly population. So, exercise can improve cortisol release, but how? A basis level is that cortisol is a controlled stress. If someone came up to you and said, hey, these are all the things you're going to stress about today, when would you like to stress about them? Most of us are going to sit there and say, I don't want to stress about any of these things, but the fact of the matter is, if you were able to schedule out your stress, you would be more psychologically ready to adapt to that stress, and your body would be physiologically ready to adapt to that stress. When we schedule in exercise, or we go for a run, or we go lift weights, we're actually scheduling and controlling our cortisol release, which is helping the body to better adapt to that stressor. In fact, one of the studies that I looked at was adolescents who exercise versus those who don't. These adolescents were getting ready for their exams, getting ready for their tests, and what was seen was that the adolescents who exercised actually did better academically, did better psychologically than those who didn't exercise, because some of them were using exercise as a coping mechanism and they were reaping all the physical benefits of exercise. So when you exercise, what happens is your stress-related cortisol is reduced and your serum cortisol is improved. So serum cortisol, that kind of ties into this diurnal pattern that I talked about earlier. It's the overall cortisol that's being tested. So we can test cortisol through hair, through saliva, or through blood. And what's happening is when you look at the overall picture, those who exercise usually have this nice healthy diurnal pattern versus those who don't. Now, one of the studies I did was with the elderly, aerobic exercises increasing the car response in older adults. So what happens a lot of times with older adults is that their cortisol awakening response is blunted. So they're still going to have this nice diurnal pattern, except when most people get this nice spike up here and then taper out, theirs are only starting down here. So they're not receiving as much cortisol in the morning. You might ask, why do we need this spike of cortisol in the morning? Well, it's not fully known. There's some debate about it, but we do know things that if you don't have the cortisol awakening response can happen. One of these things is systemic illness, another cardiovascular disease, autoimmune diseases, type 2 diabetes. Something that's interesting is a lot of these symptoms you can also receive from having too much cortisol. So cortisol is important to keep at that nice base level that we need, that nice healthy level, because if you have too much or not enough, you're going to have issues that are almost somewhat similar. So what these adults did was they went through a 6-month aerobic exercise program. After the 6th month, as you'll see on this next slide here, there was a peak in cortisol awakening response, so the 30 minutes after waking up, and then it diminished less throughout the day than when they had that blunted cortisol level. So you'll see at even 180 minutes of waking up, the cortisol levels, the cortisol awakening response is still a little bit higher than those with blunted cortisol. So this is important because this shows you that when you exercise, it's actually helping your body to regulate its cortisol better. Probably because you're getting that peak of cortisol during exercise, and so your HPA axis is having to pump out cortisol when you're more sedentary, it doesn't need to do this. Now, is there a possibility of a different result when you're doing aerobic exercise versus resistance exercise? So the study I just talked about was aerobic exercise, but some of the studies I also looked at used resistance exercise. When I studied the aerobic exercises, there was always a change in the cortisol awakening response. This always happened. But in resistance exercises, I saw that it didn't always happen. It only happened in a few of the studies. So I wanted to look into, is there a comparison? Is resistance exercise not as effective? One thing I thought about, are there possible outliers? We're looking at the elderly. Were they not able to lift as much weight? Were they not able to get to the exercise times? Were the programs not formulated for these specific people well? That could be the case. Also, is that there's different ways of testing. There's different ways of looking at the salivary versus blood cortisol. In a lot of the aerobic studies, it was always salivary cortisol, where there was a difference in the resistance exercises. Sometimes they took hair cortisol, which has been looked at to be not as reliable, or they took blood cortisol. And taking blood cortisol can actually affect the type of stress you're under because taking blood from people can cause stress. Another interesting thing was a lot of the aerobic exercise I looked at was a mix in the population, whereas one of the resistance exercise studies I looked at was strictly females. Now, if these females haven't gone through menopause yet, something that can happen is your menstrual cycle can actually affect your cortisol release. So, do I personally think that resistance exercise is not as effective as aerobic exercise? No, I think that when you're getting your body moving and you're having that peak of stress because of exercise, you're still going to get this nice, more perfected diurnal pattern and that better cortisol awakening response. Now, when is exercise harmful rather than helpful? A lot this year, we talked about overtraining syndrome. So, with overtraining syndrome, there was a study of elite soccer players, and what they saw was that when their overtraining levels went up, they took a psychological test. Let's say this over here is overtraining, this over here is their cortisol levels. As overtraining levels went up, their cortisol levels spiked too. This makes a lot of sense because you're putting the body under a lot of stress. When you're in overtraining, you suffer from overtraining syndrome, you've overworked your body, you've overstressed your body due to exercise. As I said before, exercise is a controlled stress, but that doesn't mean you can't perform too much exercise. And now, what was happening in these elite soccer players is exercise was now becoming a chronic stress. So they were seeing a lot of the same symptoms that people would who were having chronic psychological stress, that breakdown of the muscle, that breakdown of connective tissue, that breakdown of the bone. And this can become a real problem for elite athletes because we need our bodies to work at peak level. What's also happening is the HPA axis, or the hypothalamic pituitary axis, is not regulating correctly. So if your hypothalamic pituitary axis, your HPA axis, is supposed to pump out cortisol like this, 1, 2, 3, but it's being asked to pump it out at 1, 2, 3, 4. It's not meant to do that. It's not built to do that. So now it can't regulate cortisol correctly. So you'll see some maladaptations to the HPA axis, and then your flow of cortisol becomes a little bit messed up. So this is a big problem that we saw with the overtraining syndrome. Now, one day high intensity does not produce the same effects. We understand that if you exercise very hard for one day, you're not going to have overtraining syndrome. Same thing happens with your cortisol release. If you want to exercise for 90 minutes full out one day, you're not going to have the blunted cortisol awakening response, you're not going to have the overtraining symptoms, you're not going to have that breakdown of muscle from cortisol that we see in the overtraining syndrome studies. However, you probably should monitor how much you're exercising because you're still going to get that peak in cortisol that day, but you still won't see very many diminished issues. Now, one study that I looked at that I was almost going to throw out because I wondered how does this matter was, can mouth guards reduce stress? So people using mouth guards during exercise actually saw a 51% difference in salivary cortisol levels after exercise. So when they were exercising, what was happening was if you have your group that does not receive treatment or doesn't receive the mouth guard, their peak in cortisol during exercise went like this. Now, those who were exercising still had the same results. Their peak exercising with the mouth guard, still the same result. So their peak is going here. But for the people who didn't wear the mouth guard, post-exercise, their cortisol levels would taper out a lot slowly. So they weren't recovering as fast. But people who wore the mouth guard, their cortisol levels had that really deep decrease. So what's happening is that you're receiving a faster recovery if you're wearing a mouth guard. This can become important for recovery after games, recovery after practice for athletes. I looked into it a little bit, but what's happening is when you clench your teeth or you clench your jaw, you're releasing hormones that actually fight stress. That's why a lot of people, when under stress, chew gum or they'll grind on their teeth. Now, grinding on your teeth isn't very good for you, but if you wear a mouth guard, you're still protecting all of your oral structure and you're still releasing those hormones that can fight stress. So maybe if you're an athlete, it would be an idea that if you want to recover from the stress of exercise faster, to wear a mouth guard. However, why is the topic of exercise and cortisol release important? So right here on the slide, you'll see that I have a weight scale that shows good stress and bad stress. The problem is a lot of us, our good stress doesn't outweigh our bad. We're constantly burdened down by, as I said before, kids, mortgages, what should I do for a job, where should I go for college? There's lots of things in our fast-paced world that are stressing us out. But for those of us who are going to be professionals in health and exercise science, it's going to be a great tool to help people to understand that there are ways to stress our bodies in a good way, exercise. So you're adapting your body to stress through exercise. Even though you're increasing stress, your body is now learning to adapt. And you'll actually have a better time dealing with the bad stress by adding good stress into your life. So that's why it's very important to understand the effect that exercise has on cortisol. Thank you.